Thank you for staying with News Central. Today, October 24, is World Polio Day. Its purpose is to highlight global efforts to eliminate polio and the hate on the importance of vaccination in protecting children from the disease. For Africa, it's been a journey of progression that was celebrated in August 2020 when the continent was certified free of indigenous wild polio. Despite this milestone, the region is still experiencing outbreaks of non-wild variant of poliovirus in 25 countries. In 2022, wild poliovirus importations were reported in 2 countries, Malawi and Mozambique. Both had been polio-free for over 3 decades. The Global Polio Eradication Initiative says these detections highlight that until all forms of polio are eradicated everywhere, the risk of importation remains a constant threat. To discuss the current status of polio in Africa and the efforts for its eradication, I'm joined by Dr. Olorunfemi Oluwaseun, Senior Medical Officer, General Hospital, Ifako-Ijaiye, Lagos, Nigeria. Welcome to the program.
Good evening, everybody.
All right, one would think that polio-free, being certified polio-free means we're done with the disease, but that's obviously not the case. Since that milestone was recorded in 2020, has there been further progress?
Well, there have been progress, definitely. Like you said, it's not about being polio-free, but what are things that are doing to ensure that you remain polio-free and that this disease is not spread from other nations into your nations, because we live in a world where people move around. There's migration virtually everywhere, Nigeria to whatever it is, from other parts of Africa to Nigeria. So because of that, there's still that possibility of having somebody bringing the disease into another country presently. So it's not that it's totally gone, but just have to be more careful with whatever you do.
What is the current focus in the eradication quest? Is it being adequately beamed?
Okay, presently we are, just like for those that are conversant with what's happening in Lagos right now, there's a supplementary immunization activity going on presently in Lagos State. And that's where we are focusing on presently, to make sure that apart from the routine vaccination that we do for when children are born, there's a supplementary one going on. There's also the surveillance going on. So whenever you find any form of well, call it acute flaccid paralysis, not just polio, because there are other things that could cause paralysis in children or anybody. So when you find any case of flaccid paralysis, you report, and samples are taken for investigation to find out if this person actually has polio or not. Then when that is done, if there is a possibility of a poliovirus in person, there's something else called the emergency vaccination that can be done in that area and contiguous area. So for example, if I need it in Lagos State, for example, now, that means you have to do emergency vaccination in Ogun State and the border towns around Lagos State into the next country, probably Benin Republic thereabouts, to make sure that you are clearing everybody that is within that geographical zone.
Okay, are there any new challenges emerging in a fight against polio?
COVID had always been the very first of all the challenges we had, because basically all we had then were people that are not moving around the place. So we had a deficit in vaccination at that point in time. But we must give kudos to Nigeria at that point, because during this period, one of the things that was essential to be done was vaccination. Despite the hospitals were closed, it was said that every child that is born should still be vaccinated as much as possible. So if centers were open to make sure children are vaccinated, it might be given dates to come for a vaccination, but vaccination was going on. So we didn't lose that much, despite the fact that there was still a loss. Other countries lost as much as 2-3 more several percentage of vaccination was not done in several countries. We were able to do that. So that was a problem at that point in time. Next, we had the problem of people still migrating, like I said initially, that people still migrate into Nigeria and another part. There's an axis in Nigeria, Jigawa axis, where people come in, and that's where you find most of the new cases in Nigeria. And they've been able to do so much in that environment to reduce the cases of the poliovirus in that environment. There are 2 kinds of the poliovirus. The wild poliovirus, which Conte talked about. There's something called the vaccine-derived poliovirus also, which after the person has been immunized, can be a form of reaction that shows that the person has a polio, but it's not really the wild poliovirus. So that is something that we are looking at presently. And as at the last meeting of the ERC, that's the review board for what's named for emergency in Nigeria, they still felt that we had a little more to do to make sure that we reduce the chances of this happening in Nigeria.
All right, I'll just jump further ahead because you've talked a lot about the work that's being done. I'm going to ask, are you still dealing with vaccine hesitancy? Because that is one challenge we had not only with COVID, but with other vaccination exercises. Do you still have that today?
There's definitely will be everywhere in the world. There are people called anti-vaxxers. They are hesitant to collect vaccines. It's reducing drastically in Nigeria, let's be frank, because of the kind of community effort that's been put into place. We have the community leaders who have gone and given trust to the people that this thing doesn't kill. It also protects the children. They also have movement moving from a community to community, moving from house to house, informing the parents of children that this vaccine they are giving is just to protect your child and to make sure that they grow to be healthy as much as possible. And that has helped to increase the possibility of having vaccines, especially in the north. If you look at the data we have, the MICS, for example, many of the states in the south, multi-indicator cluster study, that's the MICS, many of the states in the south have 80 to 90%, even up to 95 to 99% of vaccine coverage. But in the north, we had a little bit, some as much as 70-something%, but it's improving, like we keep on saying, because the more you do, the better you get your results.
Are there any new innovations or technologies being used in the efforts to eradicate polio? And in what ways has this translated to improved surveillance in tracking and preventing outbreaks?
And then new, it's still basically what we do. Maybe just adding technology to make sure reports get there faster than before. Before you'll have probably written papers to tell the DSN, who is the person that's responsible for reporting the cases of active paralysis in your local government, who transfers it to state level, transfers to federal level. But now with technology, I could just, if I see somebody, I could call the DSN, we have so person, it's reported and quickly sent across. The samples can be taken fast enough to get if the person's polio, has the polio or not, or whatever the causing person's paralysis is found on thereabouts. What could be, most things are just basically adding technology to it, but still, oh yes, one more thing might be done. Because if you look at the schedule now, we used to have OPV before. We've now added IPV, which is something new that we're not doing before, and it's helping the reduction in the case of vaccine in polio cases. For surveillance, it's still going to be human-based. If you don't have an high index of suspicion, you may see a child that has something that looks like polio, but you may not report, because the symptoms for polio are very, very just general symptoms. They have a fever, malaise, loss of appetite, abdominal pain, vomiting. So,
those symptoms, does it mimic some other infection or disease?
Oh, yes,
that we should be curious about? So what are some of these that it mimics, and how do you distinguish between somebody that has polio and maybe somebody that has malaria? Because what you just described seems to be part of when you have malaria.
That's where the issue, that's an highness of suspicion is what we need. Because if, like I said now, those symptoms that you see could be any disease, malaria, the typhoid everybody calls around, even just generally being any viral disease. We had all this during COVID also. So anybody who come in down on the disease, and to really differentiate the index of suspicion, travel history is also very important when you're asking the patient, when you're asking and checking the patient or asking questions of the patient. The vaccination status of the child is important. So when you look at all these, put them together, you may say that yes, this is possible, and you ask for a sample to be taken to the lab to check if there's the virus in it or not, because that's the most definitive way of finding the virus or not. Okay,
you talked about the borders. Do we have a possibility of an outbreak in border towns more than we have inside urban areas? If yes, what are some of the strategies that you've used to reach these remote, some of them are really remote communities?
Okay, border areas, that means there's large migration in and out of those areas, possibly into a country, out of the country, or even with the interstates. There are plenty of movement in and out. For example, look at Lagos-Ogun border now. It's a very, very active border because many people live in Ogun State, work in Lagos State. So if, for example, there's an outbreak in just the border community alone, just look at how many people are going to be at risk of having the poliovirus. So what you do is, as much as possible, a community effort to make sure that the community takes ownership of tracking and reporting some of these things. They also take ownership of the vaccination strategies. Then, like I keep on saying, people don't understand how much Nigeria has done with vaccination in Nigeria, within a number of short period of time. Thank God to our partners. Vaccination in Nigeria is one of the most constant things that you can see. If you go to almost all PHCs in Nigeria, there's somebody giving vaccines at any point in time. There's no local government, you won't see those vaccines being given because we have mapped our primary health system so much that we can give vaccines as fast as possible and as regular as possible, which is what the national schedule has given to you. Then also when we have supplemental ones, because of that mapping, you can quickly go around the neighborhood to give the vaccines as fast as possible. So, and we have community leaders also buying into these things that we are going to give vaccine. They propagate it around the lot of the community, and it's done very, very fast.
How involved has community health workers been in trying to get the campaign on vaccination to rural communities? Do you have this them as government employed, or you have a percentage of volunteers that also get involved in trying to disseminate this message?
It's both ways, actually. Like I said, community involvement is very key. So you have government workers that have, for example, the primary health centers, and there are government workers over there who are going to give the vaccines. Then when you have the supplementary immunization activities, that's where you have volunteers that are localized in that community. They know community very well. They go around giving the vaccines, the OPVs to children. So that's a community effort, both combined effort. So you have the community on one part, you have the government workers on one part. The government part is also definitely in mapping those areas, because we can't mapping the area, I can know where people are going to live, where people are living, and what needs to be done. The age, demography of that area, for example, now, which the government comes in. And that is why we say anything you are doing in terms of vaccination is the community shared with the community and the government together.
I mean, it's a lot of work, really. Let's talk a bit about funding. In April last year, we know that the Global Polio Eradication Initiative announced it was seeking new commitments to fund its 2022 to 2026 strategy. Are there any financial restrictions or funding gaps hindering polio eradication efforts, not just in Nigeria, to your knowledge, but outside of Africa? But if you can contextualize it to Nigeria.
You have to look at the core partners for this Global Polio Eradication Program initiative. You have WHO, who always seeks funds from the members. You have the UNICEF, same as WHO. You have Bill and Melinda Gates Foundation. You have CDC. You have Gavi, then Rotary International. Those 6 are core partners in the eradication of polio. So they are going to be, they seek funds everywhere, every time they go out to get the news of polio and where we are presently out there. The more we, the more money they get, the better for everybody. There's always a funding gap for things like that because it's something that you need continuously to continue support. Yeah. So the more money you seek, the better you get your results. We have gotten from how many 300 as at 1988 when the initiative started, 350,000 positive cases to just over a few hundreds in a year, and look like just 2 countries.
To your knowledge, what has been the response to this request for more funding?
Oh, it's not the end of that, because you know, as one challenge comes in and something else is also being in place right now. So you have, for example, presently 2 key events in the world: Russia-Ukraine war and the Israel-Palestine war. So those will always take funds away from things that were either too planned or need more funding, because you have to look at the health challenges those places and quickly try to solve them as much as possible.
All right. What key lessons? I mean, there must have been some success stories in the drive to eradicate polio. Talk to us about some of the successes and what are the lessons that that was gotten from them that is being implemented.
Okay. Like you said, like I said earlier, from 350,000 people infected in 1988 to just a few hundreds in recently, and those are a success already. Because of that continuous program and awareness that's given every year and every community, you have possibly in a number of years, which is the aim of World Polio Day, to have a polio-free world. You have the countries divided into 3. Now, the endemic, which is just the 2, Pakistan and Afghanistan, I can understand why that's also happening over there. Then you have at-risk countries, and we have the outbreak countries. At-risk countries are those ones that, and outbreak countries, they've eliminated the wild poliovirus, but they should also just increase our surveillance and also the supplementary activities are doing to reduce the possibility of having poliovirus in their communities. Nigeria happens to fall into the outbreak countries, and what we do is has to be mirrored around the whole of Africa, because whether we like it or not, we are a melting pot for many countries and many things in Africa. People always come in, so you just have to increase your surveillance, which is the 4-pronged approach to polio fight: the immunization services, supplementary immunization activities, your surveillance, and the emergency response to any of the viruses, either the wild polio virus, if you do notice, or the vaccine-derived poliovirus. Do this regularly, you are going to get the very best of it.
As we commemorate World Polio Day, it's crucial to extend our focus beyond the day. What, in your view, can individuals and communities do to support polio eradication efforts in the continent?
Definitely, it's just the awareness. Once a child is born, it's imperative on the family to make sure the child is fully vaccinated. Once you do this, you have done a large chunk of work, because we are going to get to a number that's really difficult for you to spread the virus. For those that have not heard about it, you should always make sure the activities are done over and over again, and the awareness is brought to those communities. As new communities are being formed, always make sure that the awareness is there. When communities get their CDC, which is very important nowadays, they should channel all their efforts to make sure the government puts in place a health system, the public health center, to make sure that the vaccination is done appropriately. And when, as individuals, we see somebody that's having, like I said, anaphylaxis paralysis, that means all of a sudden child is not able to walk, quickly take the person to the health center or the hospital nearest so they can get child examined and history taken, so that if there's any at risk for the vaccine, for the virus, it is quickly handled, and anything that needs to be done can be done thereafter.
All right, in wrapping things up, are there any upcoming campaigns or initiatives that people can participate in to support the cause of polio eradication?
Okay, and definitely there's always one. Like I said, we've had 6 core partners. The 2 of them are going to see Nigeria easily. The Rotary International, no advert for them. They always do their campaigns and do rallies. If you can join any of them, join them to make sure this is done. Then Bill and Melinda Gates Foundation, they will always look for volunteers to help in their work. So if you can do that, always join them. And as an individual, there's no length to any story campaign to what you can do. On your social media handle, your schools, your churches, make sure you put the program, the word of vaccination, to every person you see. This is done, and you're going to get a very, very good result. And we have the outcome that all of us are praying for: a polio-free world. It's been done for several diseases, smallpox, for example.
We can do this.
So we can. For polio.
Thank you so much, Doctor, for speaking with us today on One Slot. We appreciate your insight.
Thank you so much.